Hello there, and welcome to Yodo. I'm Dr. Sarah Bohn, and this is a channel where we talk about serious illness. This discussion is about safe driving. When a person has serious illness, the disease or the medications being used to treat the illness could affect the person's driving. Aging itself certainly affects driving. I've shared with you my personal eye journey that I've had this past year, my vitreous detachment, and the progression of my cataracts, and the surgery for lens replacement. You probably already know that over 80% of the information needed to safely control your vehicle on the road comes from your vision. Today we're going to learn about other health conditions and review some general medication classes that can also affect a person's driving skills. I will offer some suggestions to be proactive with evaluation of driving skills, maintaining and improving safe operation of the vehicle. I have obtained information from the Florida Department of Transportation. They have a really nice booklet that they have prepared for Florida residents. And for some specific information to your state, check with your own state Department of Transportation. They probably have different information in your area that's specific to your state. AAA and AARP are also good resources. The population of Florida has increased dramatically since 2020, and the roads are tremendously more congested. Florida and a few other states in the nation have a greater number of people that are over the age of 65. In 2019, Florida was designated as an age-friendly state in the AARP network of livable communities. For most states, 15 to 18% of the population is over the age of 65. In Florida, during summer months, it's about 20%, and historically, for many Florida counties, this increases to 25% during the winter months. There are several reasons for the semi-annual changes in this population of Florida. It could be travel with families when school is out, summer weather being less oppressive in the northern states, and sometimes elderly will return to their homes, having that impact on that population. So Florida has resources for senior drivers, and some of the other states may not have as many of those same resources. But many of the issues related to driving for patients with serious illness have commonality with senior drivers. Change in driving skills can be slow and unnoticed, or a sudden event can cause a quick change, and the ability for driving declines rapidly, and it becomes quickly apparent that the patient has driving issues. Whether due to a serious illness or changes of driving skills that are anticipated from decline from normal aging, the effects can be similar. Over time, it's really frustrating because it limits a person. It interferes with their activities, it interferes with their daily life, it interferes with their shopping and their ability to get supplies and goods to their home. For others, the changes can be devastating, and it requires them to move to a new or different living situation. Driving is freedom, independence. Being able to go when and where you want is an instrumental activity of daily life. Personally, I've been driving most of my life. I was raised in a rural area, and I drove lawnmowers and tractors since I was about age 10, and then from about 13 on, I was behind the wheel of a pickup truck in the summer hayfields. Having an eye procedure done in May and knocking me back to one functioning eye for a few weeks was a stumbling block, not just for me, but for my family and friends. I needed rides to and from work and around the area. Our area of Florida has too much traffic for someone new to having one eye to be a safe driver. So if you're one of the people that has so graciously provided transportation for me, a heartfelt thanks. And I have a new appreciation for patients with monocular vision. Statistics show that most Americans continue to drive well into their later years. Per AAA, Americans can expect to outlive their driving ability by nearly 10 years. Most Americans will limit their driving by their late 70s, and many will cease driving at some point in their 80s. Thus, it is important to plan for those transportation needs well before that time arrives. It is not a bragging right that someone has driven past the point of time that they're a safe driver. It places the driver and others on the road at risk of injury. In Florida, we have the ability to report a silver alert by contacting law enforcement to notify of concerns of active risks due to an impaired driver. Starting in a person's late 50s, there may already be some early changes in driving skills. The ability to rapidly process multiple sources of information, remember information required for driving, judge incoming information, and process this quickly for safe driving that's needed to operate a vehicle safely is complex, to say the least. Natural changes and slowing and response time are noted, and that's typical as a person ages. We've talked about vision a bit already, But because so much of the information for safe driving is dependent upon our vision, it's really crucial for us to have our vision cared for. More light may be needed to see well. We may need to be closer to an object to properly read the signs or road markings. Our eyes need more time to recover from the light changes and interpret information that is altered by headlight glare or direct sun. We have the obvious simple things like wearing glasses and ensuring that they are clean and that we have the correct prescription for them, but this need will bring us to the eye specialist at least once per year. However, for some patients, their health and their eye conditions may require much more frequent eye evaluations. Cataracts is an eye condition that causes the lens of the eye to become cloudy over time, and thus it's harder to see the road, signs, lane markers, and discern colors. It is a slow, gradual process to develop a cataract, and it's a normal part of aging. Cataract formation is a buildup of proteins that interfere with our ability to see through the lens, and that's where those proteins are building up. There are many risks and causes for cataracts: family history, diabetes, eye injuries, steroid use, smoking. But I think the most common cause, particularly for people over the age of 50, is sun exposure. Sun damage to our skin is a lifetime total accumulation, and the eyes are susceptible as well. And for most people over 50, they spent considerable time outside when they were young, and they had no way to protect their eyes from UV damage. Now, most sunglasses and all polycarbonate prescription glasses block damage that is caused by the sun. Over time, I think we will have less of a problem with cataracts. Glaucoma is a chronic condition which the optic nerve in the back of the eye becomes damaged by increased pressure. There can be an increased amount of fluid, and the pressure inside of the eye over time will damage the nerve and the retina. For most patients, there is no pain with this increase of eye pressure, so the person has no warning signs until the disease is advanced. If you can see the difference, the changes have already begun, and it's imperative to have eye care. Risks for glaucoma include family history, history of eye injury, hypertension, and some of those are the more common ones. Macular degeneration is another process that affects the eyes. This affects the part of the vision reception area of the retina where the greatest concentration of photoreceptor cells are located. It is a leading cause of progressive vision impairment in people over the age of 65. The macula is a really small area, about 5 millimeters in size, in the center of the retina that provides the detailed vision information to the brain. When you look directly at something, you are pointing your macula directly at it. Thus, when that central vision area is decreased, the person has to rely on other parts of the retina for more information, but it does not replace the amount of information that would come from that tiny area that's the most sensitive part of that vision receptor area of the retina. Diabetes can affect a person's vision throughout the day if blood sugars are fluctuating greatly. The lens will swell or shrink depending on the amount of blood sugar that's in your body, and if there's great fluctuations, your lens is going to change in time. Over time, though, diabetes can permanently damage vision by affecting the blood vessels and the retina itself. Most people with diabetes are accustomed to having regular eye examinations. This was a short list of the more common eye issues, and any of these could result in vision changes resulting in impaired driving. The problems may include blurry vision, difficulty seeing at dawn or dusk, certainly night vision impairment, light sensitivity either from the sun or from headlights, glare issues, seeing halos or light streams, double images, faded colors, issues making out road signs, difficulty accommodating from distance vision looking down the road to rapidly focusing on the speedometer or maps if you have your maps open. Your peripheral vision can be affected by some conditions and central vision affected by others. Having regular eye visits is so important. Your eyes deserve the attention that you can give them. The next conditions that I will review are those that affect cognition. This is how well you coordinate and organize all the sensory information coming into your brain, interpreting your surroundings, reacting appropriately, maintaining attention, managing memory, processing information, and problem solving. As discussed in the dementia series on this channel, there are many types of cognitive impairment, and each has its own set of stages and specific trajectory. To name a few types: Alzheimer's dementia, Parkinson's, Lewy body, frontotemporal lobe, mini stroke-related or vascular dementia, and even impairment from multiple head injuries can all result in disability managing motor vehicle safety at high speeds. Impairment from any of these medical issues may include distraction, slowed response, delayed reactions, issues with timely processing of information about closing distances and speeds, recognizing and quickly acting on changing traffic conditions, road hazards, or emergencies. Disorientation, possibly issues with proper vehicle operation of the controls or headlights, the accelerator, brake, turn signals, wipers, hazard lights. Higher executive function problems, difficulty planning and executing travel plans, developing a route change on the fly. And certainly, if there's been evidence of confusion or if the person has become lost, there is reason for concern. Difficulty with navigating through cones or barrels that are related to road construction, or maintaining the control of the vehicle when the road width is narrow due to a parked car or delivery vehicle. Any of these can result in decreased ability to maintain ongoing, continuous safe control of the vehicle. If there has been a recent wreck or crash or fender bender, keep track of these and the time and circumstance of these. It might not be related to a memory concern, but if a pattern is developing, do not ignore it. A motor vehicle is a lethal weapon, and we must be proactive if memory, judgment, decision-making skills become impaired to ensure the safety of everyone on the road. Our brain is like any other body part and needs to be kept in shape. Reading, crossword puzzles, Sudoku games, memory exercises can all help. Also important for brain function is interacting with others, whether family members and playing dominoes, Monopoly, or a strategy game. There are many phone app memory games that are available. Most communities have senior centers that offer free or low-cost activities and classes that promote keeping a person's mind and body active and in shape. There are other common medical conditions that are also highly likely to adversely affect a person's driving ability. Parkinson's is a medical condition that affects the brain and central nervous system and controls muscle movement. This often causes tremor, shaking of hands, arms, or legs, but for some, the condition results in the sensation of muscle stiffness or rigidity. Patients describe having delayed reaction. They know what they want to say or do, but the execution of that is just too slow as compared to what they feel like it should be. This can even be evident in conversations. When someone with Parkinson's answers a question, there can be a longer than normal pause after you ask the question before they begin to make their response come out. They know what they want to say or do. It's the initiation of that action that takes longer. It's very common for Parkinson's patients to voluntarily stop driving as they're very cognizant of that change in the response time. They describe a sluggishness with the movement of their body, and a sense of muscle molasses is very frustrating and can be frightening when they're behind the wheel of a car. Some Parkinson's patients may develop cognitive impairment in addition to motor effects and changes from this illness. Arthritis changes are also a common contributor to discomfort behind the wheel. Discomfort physically and causing worry for the driver about safety. We all know that physical ability declines with age. Loss of muscle mass is a normal part of the aging process. A decrease in bone strength and joint range of motion decrease are also typical. Some patients are limited a little bit more early and more severely than others with mobility changes due to joints, ligaments, and muscle changes that are occurring particularly from arthritic conditions. Aging and illness can also result in sensory issues in our hands and feet with decreased sensation. Problems knowing where our feet and toes are, where our hands and fingers are positioned on the wheel, and we can also have distracting issues of numbness, tingling, and pain. Some of this is related to arthritis, some of it is related to other central nervous system issues. So pressing on the accelerator or brake and grasping the steering wheel or reaching for the turn signal or headlights can become more difficult. Decreased flexibility and limited range of motion of the neck, upper extremities, hips, knees, ankles, they can all alter our skills behind the wheel. These neurologic issues that can occur will disrupt our balance, they can result in dizziness, vertigo, and they can also add to the burden of being a safe driver. For some patients, getting into and out of the vehicle, being able to fasten the seatbelt, or having back, hip, or knee pain from being in the same position for an extended period of time become difficult and painful. When you're driving, you can't really stretch your legs or reposition easily at 60 miles an hour when you're the driver. For people that have suffered a stroke, these patients may have permanent residual paralysis or weakness. Not all strokes are motor strokes involving muscles, but some can occur in other areas of the brain that involve thinking, and there's no motor signs, but the patient can tell that there are certain tasks that they are unable to perform any longer because that part of their cognition has been changed. It's not uncommon for patients with a history of stroke to also willingly limit or discontinue driving. I don't want to miss talking about hearing. Hearing certainly does alert us to some road and auto issues, but it's not as crucial as vision. Hearing evaluations should be done to evaluate any concerns. It is common for people to instantly reduce the volume on their radio if the road conditions or the traffic situation changes, because we do want to limit that input of information so that we can focus more on our vision. Medication effects can cause anyone of any age issues with driving. For some, medications that they have taken for many years can begin to cause issues with vehicle operation. 80% of the people over the age of 50 take one prescription medication, and 90% of people over the age of 65 take 2 or more prescription medications. Any medication that affects muscles, brain, heart, or emotions can cause issues with the ability to safely operate a motor vehicle. So broad classes of medications to consider are antidepressants, antihistamines, anti-muscle spasm medications, antipsychotics, anti-seizure medications, bladder medications, some GI medications, some heart medications or blood pressure medications, pain medications, tranquilizers, sleep medications, and some cancer medications. Yikes, it's just a lot of different classes, let alone the individual meds that can interfere with a person's ability to drive. For some people with health issues, they may question if they even want to have a car. A personal vehicle is independence, though. It's freedom. In some areas, there are few to no other transportation options. Our friends in Alaska once told me that Amazon Prime is life because of the free delivery. But even with the many delivery services that are now available for food or for goods and services, the proclivity of Uber and Lyft services that are present, it takes a lot of coordination and planning because it's not available in every area. For some rural areas, it's extremely limiting to not have a vehicle. Having a vehicle, though, is a burden. It's a burden to the environment, and it's a burden financially. There are a lot of expenses to owning a vehicle. In some cities, parking your car is very difficult and possibly expensive. In some cities, they may not include parking with the rented apartment or townhome, and street parking may be limited. If street parking is available and it's on a snow route in the northern area, that may not be available during winter conditions. To help look at expenses of owning a car, AAA and AARP has some car cost worksheets that are available. And these are very helpful looking at questions about monthly payments, cost of annual routine maintenance, oil changes, repair costs, air conditioning, transmission or body work, routine upkeep including tires, wipers, car battery, insurance, license and registration, fuel, parking, tolls. There are just a lot of costs to owning a car, so it is a big decision. In Florida, we have findarideflorida.org to assist finding transportation options. There are warning signs that a person is having more issues with driving and maintaining good control of their vehicle. Becoming more uncomfortable behind a wheel, squinting or avoiding driving at certain times of the day or night, difficulty staying in the correct lane, trouble merging at the correct speed, being honked at, getting lost, missing stop signs, stopping too soon, or missing red lights entirely, receiving citations or traffic violations, holding up traffic by driving too slowly or missing a turn, difficulty responding to an unexpected driving situation, experiencing a close call, finding dents or scrapes on the car, mailbox, the side of the house, or having issues parking, trouble judging distances and gaps in traffic or at intersections, temper control issues or becoming angry while driving, others that refuse to ride with you, difficulty seeing the sides of the road when you're looking straight ahead, becoming easily distracted, decreased ability to turn your head and look to the side and behind you, and fear of driving. The AARP provides a driving self-assessment quiz. This is a list of a few questions, and the driver is to be ranked on these from 0 or never, occasionally, frequently, or always is at 3. If the score is greater than 5, additional evaluation is advised. Being honked at, finding traffic gaps hard to judge, finding that cars can suddenly appear from nowhere, drivers that stop suddenly in front of you, trouble looking over their shoulder or to safely back up or change lanes, trouble remembering to look right, left, and then right again at intersections, trouble driving through intersections, nervous making left turns, not feeling confident in heavy traffic or at high speeds, feeling overwhelmed by signs, signals, pavement markings, other vehicles, motorcycles, or pedestrians, trouble moving feet or legs for brake, accelerator, or turning the wheel, getting lost in places that are familiar, feeling nervous, agitated, irritated, or angry when driving, and having several fender benders in the last 3 years. Being a good driver includes being proactive to maintain safe driving skills for life, taking care of yourself with medical care, wearing glasses if you need them, being familiar with your vehicle and being comfortable in your vehicle, wearing your seatbelt correctly, using indicators appropriately for turn signals, hazard lights, your headlights, maintaining attention to the road and limiting distractions while driving. Don't drive if fatigued, sleepy, weak, or under the influence of a medication or chemical. Watch out for pedestrians, bicyclists, alligators, those big blue cranes that stroll slowly across the road, and golf carts. And where I used to live, we needed to watch for cars and autos and motorcycles, but we also had to watch for wagons, tractors, a horse and buggy, and the occasional cow or sheep that is out of the pasture and on the road, or a deer that's crossing the street. Be aware of road conditions, potholes, debris, construction, sand, dusk, dawn, night, rain, wind. Where you live, you might need to include sleet, ice, or snow in those road conditions. Keeping a safe distance in front of you and beside you, using caution when backing out of a space at the store, driving at appropriate speeds, and being aware of and moving over for approaching law enforcement and emergency vehicles. There are proactive things you can do in addition to routine eye and health maintenance. Most communities have senior centers with activities and resources, online learning classes that you can do from home for driving and keeping your mind sharp. Speak with your physician about an evaluation by a driving rehab specialist. A driving rehab specialist is someone that is trained in performing a driving evaluation. Some of this may be done in an office, or more in-depth evaluation may involve getting into the car. They will assess physical, visual, and cognitive abilities of the driver. They can recommend accommodations and assist with finding driver courses, provide behind-the-wheel training, assist with transitioning from driving if needed, and they'll provide a written report to the referring specialist with assessment and recommendation. There is a variety of adaptive equipment that they can recommend as well, modifications that are available that can affect safety and comfort of the driver. These might be mirrors, pedal extenders, a seat lift, steering devices, and hand controls. It's pretty amazing, really. The program developed by AARP, AAA, and American Society on Aging called CarFit promotes safe driving conversations and community transportation resources. The program helps people learn about safe distance between the driver and the airbag, proper position of the seat and mirrors for a specific driver, safe line of sight over the steering wheel, and ensures understanding of the correct seatbelt placement. Some states have online and in-person safe driver courses, and you could receive a discount on your insurance for participation. Drive the car that is right for you. Trading cars often is a nice luxury, but having a vehicle that is kept in good running condition that you are familiar with is advised. Muscle memory in sports transfers to the use of any activity. Turning on the wipers or a turn signal without much more than just a glance is easier in a familiar vehicle. Changing vehicles brings change in design features, and the few seconds that it takes to readjust when a sudden challenge of a road condition occurs could lead to a wreck. Vehicle technology is changing all the time, and as much trouble as we can have operating a TV remote, there's a lot more at stake than just frustration with a vehicle moving at 55 or even 70 miles an hour. Ensure that your vehicle does have proper maintenance, the correct tire pressure, and the tires aren't worn out, that you've got good wipers for using when you need them, the brakes and lights are all working properly, and that the oil and other fluids are getting the attention that they need. In summary, having the ability and skill to drive safely is a big factor in a person's independence. Having a serious illness does not mean that they will be giving up driving at a particular time, but it does present that the number of years or months that a person has to drive independently may be nearing an end. To be able to extend the time remaining as a safe and competent driver, there are a lot of proactive things that can be done. I was greatly impacted personally when I suddenly stopped driving for a few weeks this summer. I have so much respect and admiration for those that independently make the proactive decision to limit or stop driving. It takes planning and teamwork from loved ones and friends to fill in the gaps. It is a brave decision one has made when they decide they're no longer going to drive. I do think that it's better that the decision is made voluntarily than after a bad incident with property damage, injury, or death occurring. If possible, transitioning slowly can assist everyone to acclimate, but for some that's just not an option. In my case, it really wasn't. Keep in mind that one thing that stays the same is everything is always changing. I'm glad that I've got my vision back and I'm able to drive safely, at least for a period of time, and we'll see what happens in my future. I hope this has been helpful to enlighten you to these concerns, and if you have a parent or a neighbor that needs assistance, please lend a hand. These are difficult decisions, and it requires support from all when these issues arise. If you or a loved one has become lost or confused or has an issue getting from one common location to another, please investigate. A safe driver needs to be calm and comfortable and well acclimated to their vehicle to be able to process all that incoming information. They have to rapidly respond and accurately respond. They must cognitively process and physically react and have that ability to see and hear what they need to do. I hope this information has been helpful for you and that you're able to share this with others that may need to hear the information. Thank you for clicking on the subscribe button and giving me that thumbs up, as it does show YouTube that the information is good and it promotes it to others. If you have a request for a video, please leave it in the comments below. The presented content does hop around a bit because if a viewer requests information, that's bumped up in the list. Plans for a cognitive tissue disease review and information on Ehlers-Danlos will be coming soon. Thank you for being here. Bye now.